Hello, everybody, and welcome to the several hundred people who have joined us for tonight's webinar, and also the viewers who are watching the recording, which will be out in due course. MHPN would like to acknowledge the traditional custodians of the land, seas and waterways across Australia upon which our webinar presenters and participants are located. I'm currently on Balangurra country in the north of Western Australia, and we pay respect to the elders past, present and future for the memories, the traditions, the culture and the hopes of Aboriginal and Torres Strait Islander Australia. So Steve Trombl's my name. I'm a general practitioner by background, currently travelling, and I'll be facilitating tonight's session thanks to the miracle of modern technology from El Questro station in the Kimberley. So there you go. I'm involved in medical education, and one of the things I really enjoy is doing these webinars. So we're lucky tonight to have a wonderful panel. I'm not going to go through their bios in detail because they were circulated with the webinar. But the first person I would like you to meet is Bill Buckley, who's from Victoria. He's an alcohol and other drugs mental health educator with lived experience. So Bill, as an educator in the AOD sector, what key messages do you provide for your students about the importance of language when engaging with clients?
Well, Steve, I'd generally like to stress the importance that language does play and that you can't underestimate the impact that language does have on someone's ongoing recovery.
Great. So really important then to make sure that we're using appropriate terminology, which I know we'll come to in more detail with your presentation. So looking forward to that. But Mary, so Dr. Mary Himalayas is a psychiatrist based in where Queensland meets New South Wales on the coast there in Corumba. An introductory question for you, Mary. From what Bill said, the terms we do use to describe people are very important. How does this sit with the health system's need to label us with a diagnosis before we can access services?
Steve, I think that would probably be a topic of its own for another webinar. But I think that there are definitely, there's an art of balancing what the system needs, but remembering that we treat people, not disorders. And it can be really difficult when you feel as a clinician or a helper backed into a corner where you've got to give someone a label, which they might find stigmatising. But on the other hand, some people find diagnoses really helpful and sometimes they're very important. So in tonight's case, for example, alcohol use disorder kind of indicates the severity of the problem, which actually can be clinically very important. So I think the answer is it's complicated.
Okay, thanks for that. I've heard it said that labels are for jam jars, so I suspect that we'll come to that later on. As you say, it's a carefully balanced decision about how much labelling to do in order to get access to services without stigmatising.